All right. Well, good morning, everyone. It is June 19th, 9:02 a.m. Thank you guys for being on the call this morning as we are getting ready to close out Q2 of 2023. And things are moving quite fast here. We're getting into certification season now. I'm already getting questions in the chat here. I'm going to address those. Thank you very much. But before we go deep down the rabbit hole here, why are we here today? And I hope it's not just to earn a paycheck. We are here to improve the lives of our community with affordable health care. And that's why we're here. That's why we do what we do. So thank you for being a part of that mission. And thank you for doing what you're doing for our community and for your clients. Without your expertise and knowledge, where would they go? What would happen in the world? So thank you for being as smart as you are. Thank you for continuing to learn and keeping one foot in the classroom and the other one in the field at all times. So with that, let's jump over to our training calendar. Got a nice solid week of training here. All right, so today we've got a training for knowing your SEPs for all year selling opportunities. That looks like a Humana thing. That's happening today at 12 o'clock. So if you are interested in being consistent with your marketing, you need to know SEPs. If you're weak on your SEPs, you're not sure about what special election periods are, you don't know which ones are which. We're going to talk about one in particular today. This is a good training for you. So check that out. It's going to be very, very important for you to know your SEPs. All right. Also today at 4 o'clock, United Healthcare is doing their virtual office sessions. They do those a couple times during the week. Today is at 4 o'clock, and then on Friday at 3 p.m. So those are virtual office. You can jump in and do what you got to do on that to learn more or ask questions about United Healthcare. Very, very important for you there. On Tuesday, the 20th, that's tomorrow, 10 a.m., we've got Centerwell, their pharmacy hybrid training for Humana and Care Plus. If you are doing Humana and Care Plus enrollments, then you're probably going to want to learn more about their Centerwell pharmacy. This is a mail order pharmacy, and they've got a hybrid situation happening. So check that out. If you haven't been to one of those pharmacy trainings, you might learn a little bit on the Part D, which could help with sales. So there it is. Also tomorrow at 11, Cigna's doing their office hours. So questions, concerns, anything you got for Cigna, they're going to be there at 11. Devoted is doing an open training class. Devoted, the fastest growing Medicare Advantage plan in the country. If you're not selling Devoted, you are missing the boat. They are doing things very, very well. We had the opportunity to go up to Boston to visit their headquarters and meet their leadership, and just an unbelievable culture there. Very different from anything that we've seen before. Very strong products. They are expanding into new counties and not in new states. So they're in the same states as they were last year. Here in Florida, they're just expanding into one additional county, which is St. John's, which is the St. Augustine area up in Northeast Florida. So if you're around about that area, that's a good opportunity to join Devoted right now. So send us an email at contracting@askhpm.com and we can add you in for Devoted if you're looking to do that. But they're doing a training, it looks like once a week, every Tuesday, 11 a.m. Come on in. The water's great. Okay. We've got live Ask Al. Our very own Al Clancy is available for you to torture. Just kidding. He's there to make you smart. Okay. So if you really the opportunity here, guys, is to get a personal one-on-one coaching session with the man, the myth, the legend, Al Clancy. Okay. He has expertise in Medicare, Medicare Advantage, Medicare supplements. If you're lost, if you just need some ideas, if you want to prep for AEP, if you have marketing, if you have compliance, if you have anything at all, this is your opportunity to spend an hour, hour and a half with Al. He's going to be live in person, and that is 4700 Apopka Vineland Road, which I believe is a Panera Bread. Let me check it out. And it's a Panera Bread. So check that out there. He's over in Orlando 32819, which is, I believe, right over there by the Universal area. So you can check that out. Now, he's doing a virtual version of this as well. So if you're not close by in Orlando, that's fine. You still have access to Al. And he is doing a virtual coffee and chat session every Wednesday at 9:30. So If you can't make it on Tuesday in person, Wednesday at 9:30, he'll be on the phone there, and the link to the Google Meet is right in the calendar here. Remember, if you don't have this calendar, please reach out to a team member so we can get you hooked in. We can get it on your phone, laptop, iPad, whatever's easier for you to ensure that your brain is growing. So Al is there, virtual office on 9:30, but if you want to see him in person, he will be live on stage 2 o'clock tomorrow. Panera Bread, Apopka Vineland Road. There it is. Okay, Wednesday at noon, Selling Humana Care Plus, the chronic special needs plans. Now, this is all about special needs. Guys, from here until October is lead generation mode. But it's also an awesome time for you to continue to do sales with what you currently have, okay? If you're not doing events, if you're not reaching out to your book of business, if you're not doing any type of lead management right now or marketing, you're going to have a very, very, very sad AEP. Okay? So, yes, we're going into certification season, but you have to continue to market yourself. All right? Now, you're going to come across people that have diabetes, chronic obstructive pulmonary disease, high blood pressure, chronic heart conditions. All of these scenarios with chronic conditions allows you to enroll somebody in a plan effective the first of the following month. You don't have to wait until 2024 to get your money. And your member gets an awesome plan and they don't have to wait until January to start using benefits. There are tons and tons of people out there that you can access by going out into the community. You have to go out there. They ain't going to walk through your living room. Okay. If you need help with events, let us know. But chronic condition special needs plans is something you absolutely have to learn if you want to grow your book of business during lock-in. Okay. Humana does an excellent job. They've got 2 plans, Humana Care Plus, that can help you learn about chronic special needs plans. There it is. That's at noon on Wednesday. Also on Wednesday, Cigna's doing another virtual office. We already talked about that, so that's available. Wednesday, 2 o'clock, Humana is doing the dental and vision training. Another awesome thing that you should learn. Why? Because it's additional income. It's an ancillary product. It gives you the ability to do things you can't do for Medicare, right? You can start somebody on a dental plan and then call them about Medicare Advantage or ACA, you know. But we have agents that are earning an extra $1,000, $2,000 a month because they just continually sell dental and vision, and they've been doing it for years. So I don't know if you can use an extra $1,000 a month. I don't know. Learn. 12:30 or 2 o'clock on Wednesday. There you go. Devoted is doing their rock and roll. I love this. Their rock and roll sessions across the state, and this is their kickoffs. Okay, what? It's June. Carriers are doing kickoffs already. What's going on in the world? Is there a black hole somewhere? No. Devoted is first out of the gate, and they are not stopping. So June 21st is the first one. They're in Pensacola. So that's the first one. They're going to be doing these tours across the state. If you haven't already signed up for a rock and roll session, I highly recommend it. If you're considering adding Devoted to your portfolio, I highly, highly recommend that you go check this out because they do the party good. Okay. So the first one's on Wednesday at 2 o'clock in Pensacola. So if you're in that market, you can go up there and check it out. That's at the Fish House. And then these are going to be once a week throughout lock-in to keep fresh. Moving over to Thursday, Humana is doing dual eligible plans and resources. Another great training. Do you know Medicaid? Do you know how to apply people for Medicaid? How about this, guys? Did you know that we have somebody here at Health Plan Markets that can help your members apply for Medicaid on your behalf? You know, hey, Justin, I don't do Medicaid because I don't want to deal with the applications. I don't want to deal with checking on it. I don't want to deal with recertifications for Medicaid. It's all right. We got somebody that can help with that. Okay. Reach out to us. We'll tell you more about it. All right. Do you have members that are currently on Medicaid and are losing it? Well, it's over 1 million people in Florida that are about to lose Medicaid. Might be a good idea to learn about it because that's an opportunity right there. To help people. I recommend that you learn how Medicaid works because you got to explain it to your clients, right? That's my recommendation. But we also have somebody internally. If you don't want to deal with it, you can reach out to us and we'll connect you with Angie. We'll tell you all about it. We can help you apply, help your clients apply and recertify for Medicaid. Cool? Awesome. But that doesn't really lead to money. This does. You have to learn how Medicaid works to open up a special election period, to get them on a dual eligible plan, to earn a commission, to get them on a plan for next month. Okay. It's all connected. All right. So check that out, 10 o'clock on Thursday. Also on Thursday at noon, if you're new to Humana, this is a great training. If you haven't been to a Humana training class in years and you haven't sold one in a while, might be a good idea to check that training out too. That's at noon on Thursday. That's a training for the week, guys. Have one foot in the classroom and the other one in the field at all times. I'm being asked about AHIP. AHIP is rolling out very, very soon. I was told it's today, but they might have a glitch in the system. So I always recommend that you wait for AHIP to roll out here, maybe a couple of days, because there's always a little bit of like this nuance of like it not working right away. We see that happen. So let's take a look here. So so this is the notice. The plans are already starting to notify you about their training sessions that are rolling out as well. But you know, AHIP, we'll go over to the website here. So AHIP is the first stop traditionally in getting your training done first with AHIP, because some carriers have their own training classes and you might be wasting your time if you do those versus waiting for the AHIP to come out, waiting to get into AHIP, getting your annual certification done, and then going from there, okay? Now, you can get a jump start. United Healthcare is already allowing you to do your certification class, but it does look like June 21st. They might have pushed it back a couple of days. So it's normally $175 for your AHIP training, okay? But most carriers give you that $50 discount. So again, if you don't care about the $50 and you just want to get it done, June 21st, log into your AHIP, should be able to start your 2024 training. Go, 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 go. But if you do care about $50, go ahead and wait until a carrier comes out with their discount, and then you can access the $50 discount through a carrier. You have to do it through the carrier. You will not be reimbursed for this. Let me repeat, you will not be reimbursed. So if you go out there and you spend the $175, you're not going to get reimbursed. Don't ask. It's not going to happen. Okay. So if you want to save your $50, wait for the discount to come out. Check your emails. It will be rolling out soon. Okay. So if you're checking in, trying to get in your AHIP, it's not working, it's because it's showing June 21st. Okay. Cool. We got that settled. Let's jump over to, Google review. We've got a contest rolling, guys. We got 25 reviews. Thank you guys for helping me out. Hopefully you got my emails, my text message about our reviews and how I messed up pretty good. I appreciate the 25 folks that went in there and did a review for us at Health Plan Markets. Again, the contest is live. It ends at the end of this month. And as a reminder, for every review, you get a $100 restaurant voucher. So things like 50% off, buy one, get one, 10 bucks off, 20 bucks off, $100 worth of restaurant vouchers just for leaving a review. It's an honest review. You know, you don't have to give us 5 stars. Just tell us how we're doing. It's good feedback for us. And then for the vacation, we will pick one person that left a review for a free vacation. Okay. So we're going to do the drawing on the 30th at the end of this month. So if you're interested in a free vacation, you might want to go out there and do a review for us. We really, really appreciate it. We're giving away lots of great stuff from now until kickoff for AEP. So that's a review. And as a reminder, I'll go ahead and pop in the link here into the chat. So if you want to go ahead while you're listening to me yak, you can leave a review on our Google page right now. So there it is. It's in the chat there. And you can go in there and leave us a review. We want to give away cool stuff. Okay. Restaurant vouchers. I've got a bunch of them. And then that free vacation, we're going to do a raffle spin the wheel kind of thing for everybody to win a thing there. So There it is. Okay. We had some pretty interesting news over the weekend. I want to share with you that CMS, our beloved CMS, has rolled out some new rules, this time with ACA. And they came out with a letter that said on June 18th, yes, yesterday, that this is going to begin. ACA is now going to require consent to contacts. So if you're selling individual and family plans on the marketplace, you will need to start collecting consent to contact like you do with Medicare. Okay, it's moving in that direction. So I'm going to go ahead and read the CMS letter. It's not long. It's only about 2 pages here. So you guys are familiar with this new rule with CMS. It is effective immediately, and we're going to talk about it. Now, there's even a form here that you can download, and we're going to load that into our gold key as well. So let's go ahead and go through the letter here. This is from the Center for Medicare and Medicaid Services. This is a legal disclosure. The contents of this document do not have the force and effect of law and are not meant to bind the public in any way, unless specifically incorporated into a contract. This document is intended only to provide clarity to the public regarding existing requirements under the law. This model consent form, we're going to talk about that in a minute, will not supersede any state agent of record, broker of record, or other form required by QHP, Qualified Health Plan Issuer. So, for instance, Ambetter, for purposes of making commission payments to the proper agent or broker for assisting a particular consumer. Okay, so this is starting today, moving forward. It does not affect your commissions. It does not affect your agent of record today, all right? Only moving forward after June 18th. The purpose statement: registered agents and brokers assisting consumers apply for and enroll in marketplace coverage must document consumer consent prior to accessing or updating their marketplace information. CMS does not prescribe the manner in which agents or brokers must document consent. Okay, you can do it in several ways. Instead, there are different formats that may be acceptable for agents and brokers to use to document consumer consent, such as via a recorded phone call, text message, email, electronic document with digital signatures, physical document with wet signatures, etc. This model consent form serves as an example for how agents and brokers may document consent via a physical document with wet signatures. Okay, so I'm about to show you what the CMS version of this form looks like. But the baseline is this: if you have somebody contact you because they were a referral from a client, that's consent to contact. Okay, if they contact you, you do not need their consent to respond. Okay, just make sure that you document that somewhere, that they reached out to you on this day by phone, by email, by text message. You're documenting that. So having a CRM system is kind of a smart thing to do. Okay, we've got one. So I know we have it for Spark for Medicare, but if you're doing ACA, we can help you with that as well through Keep, which is what we're using. So depending on what your preference is, just make sure that you're documenting that somewhere. Now, we also use Health Sherpa, so there might be a good spot there. I know Health Sherpa is working on this right now. So they will probably have consent to contact forms baked into Health Sherpa, which is our preferred enrollment platform. Okay. But in this document already, it's saying you can collect their consent by email, text, phone number, however you do it is fine. Just make sure you keep it somewhere, okay? Now, it's not as stringent as Medicare's yet. Like, there's not a time limit on how long you have to keep it and yada, yada. This is just developing for ACA. All right, let me continue. Since this model consent form is a best practice for obtaining consumer consent, you may tailor the form to address the needs of your specific business model, in addition to meeting the CMS requirement to document consent from a consumer prior to assisting the consumer enroll in coverage in the marketplace, including prior to conducting a person's search. For example, if an agency is involved, you may clarify specifically who else within the agency, other than the writing agent, is able to view and use the consumer's PII, personal identifying information, to assist the writing agent in enrolling the consumer in marketplace coverage for compliance, commissions, or other relevant purposes as you see fit. Okay, so this is their version of consent to contact directly from CMS. Okay, and I'm going to read through this form so you have the general idea of what this entails, because you can create your own. At this point, you can create your own. All right. Will that always be the thing? No. But you can use this form if you want. Reach out to us if you want this. You can download it from CMS. It's Appendix A, Agent Broker Consent Form. I'm sure you can find it. If you need it, let us know. We'll happily give that to you. I'm going to empower the team to have that on deck here in a few minutes. But here it is. Okay, so CMS Model Consent Form for marketplace agents and brokers. In other words, this is their consent to contact form for individuals on the marketplace. So I, consumer's name, give my permission to you, the agent, to serve as the health insurance agent or broker for myself and my entire household if applicable, for purposes of enrollment in a qualified health plan offered on the federally facilitated marketplace. By consenting to this form, I authorize the above-mentioned agent to view and use the confidential information provided by me in writing, electronically, or by telephone only for the purposes of one or more of the following. Searching for an existing marketplace application. Somebody calls you and you just want to look them up. Got to have consent. Completing an application for eligibility and enrollment in a marketplace qualified health plan or other government insurance affordability programs such as Medicaid and CHIP, or advanced tax credits to help pay for marketplace premiums. In other words, making sure that they qualify. Providing ongoing account maintenance and enrollment assistance as necessary. Responding to inquiries from the marketplace regarding my marketplace application. Okay. So let me pause there for a moment. Basically, anything that your members need on the marketplace, you should have a consent to contact in place. Okay. So you're going to have confidential information from the member. You can collect it in writing, electronically, or by phone. Doesn't matter. Just keep it somewhere. Okay. Now, I understand that the agent will not use or share my personally identifiable information, PII, for any purposes other than those listed above. The agent will ensure that my PII is kept private and safe when collecting, storing, and using my PII for the stated purposes above. I confirm that the information I provide for entry on my marketplace eligibility and enrollment application will be true to the best of my knowledge. I understand that I do not have to share additional personal information about myself or my health with my agent beyond what is required on the application for eligibility and enrollment purposes. I understand that my consent remains in effect until I revoke it, and I may revoke or modify my consent at any time by insert method to revoke consent. So that's up to you. If you want them to mail you, email you, text message you, phone call you, whatever it is, you can put that right in there. So on the form, you're going to provide your name, your NPN number, your phone number, and your email. Okay. So you can have these on deck already pre-printed if you want and have them ready. You can have a digital version of this if you want. And then the name of the agency. So the agency for all of you is Healthland Markets. That's the hierarchy there. So Healthland Markets, we'll go ahead and give you our NPN number. In fact, I have it here, 169-33-169-33-005. And that's in the chat there in case you need it. The owner of the agency, you can put my name, Justin Jacobs, phone number, and email address. Okay. And then, of course, the person's information there, their name or the authorized representative's name, the phone number, the email address, their signature. Please don't miss this. This is the most important part. And the date that they signed. Okay. So again, this is the government's consent to contact form. All right. And you can use this if you feel like this is best scenario for you. Okay. But here it also says that you can create your own. So however you want to design this, or create some kind of consent that says, yes, I give Justin permission to help me with my marketplace plan. The other point I wanted to make is this is for folks that are working through the marketplace and not specifically through off exchange plans. So from what I understand, this does not pertain to individual plans that are off marketplace. Okay, this is just on marketplace. So if you're helping people off marketplace, going directly to the carrier, getting them enrollments, you're fine. Okay, you don't need consent at this point. But as a general rule, I would just go ahead and get consent from everybody. At this point, just say, hey, in order for me to continue, I just need to make sure that I document that you've given me permission to talk to you about your health insurance. Okay, so many of you already have recording capabilities of a phone number that you can call. We're using RingCentral here. However you're recording your phone calls, go ahead and you can start using that for ACA. If that's easier for you, you're good to go. Okay, just make sure you have a good script in place. If you need help developing a script, let us know. However, basically this is your script. Okay, however you want to slim that down or make it sexy, it's up to you. Okay, but there's your form. Again, we're going to save this. We'll send this out to everybody. If you need it right away, reach out to a team member and we'll be glad to ensure that you've got this. So this consent to contact form for ACA is called the CMS Model Consent Form. So it's called a little bit different, Model Consent Form. Hopefully that brings a little bit of clarity. Sorry, guys, I don't make up these rules. I'm just here to make sure that you keep your nose clean. That's it. Okay. So moving forward, if you have an ACA client, you need to have consent to contact. Even if they just say, hey, can you look me up? Can you become my agent of record? Whatever it is, grab the consent to contact however you're doing that. Okay. Okay, last thing on deck this morning that I want to share with you is a notice that Humana had sent out regarding pharmacy assistance programs, specifically the state pharmacy assistant program. Okay, so Marketplace, which is their compliance, Marketplace Sales Integrity has seen a significant increase in usage of the SPAP SEP code within recent months, which has led to a corresponding increase in member complaints. The PAP code is intended to be used in limited circumstances as referenced below. Therefore, a significant / sharp rise in utilization can be an indication of incorrect or improper use. As we continue to monitor this trend, please reinforce compliance applications of pharmacy assistance program special election periods. If your agency is found to be utilizing the code in an improper manner, further mitigation and remediation will be required. Additional training and resources can be found in the Humana Marketpoint University. Okay, what is the State Pharmacy Assistance Program? Well, there's programs out there that can help outside of LIS, low income subsidy, and outside of Medicaid that you can apply for. Okay. My favorite resource is the one we use internally, benefitscheckup.org. Okay, benefitscheckup.org. Now, if you use that website, congratulations, you are now a community resource because you have every single special program out there at your disposal. So one of the programs, when you click pharmacy assistance or prescription drug assistance, you can apply for state pharmacy assistance programs or pharmacy assistance programs that are available across the state or through manufacturers. So if your clients apply for one of these programs and are approved for one of these programs, that opens up a special election period for your member, and you can enroll them in the plan of their choice, effective first of the following month. Okay, so helping people get help with their medications rewards you with an opportunity to enroll them in that for them to become your client. Okay, so the SPAP situation, there's been a lot of agents out there that are just putting SPAP and Humana is accepting it as an SEP, even though the member never applied and does not qualify. Okay, so that's basically what this notice is about. Don't do that. All right. take the extra 5-10 seconds, help them apply, or send it over to Angie internally. She'll help them apply for extra help, the SPAP programs. And if they're approved, congratulations, you have an SEP and you can get them enrolled in a plan. They can make one change. So I'm going to go through the SEP itself so you guys are familiar with this SEP, because this is across all states, by the way. This is not just Florida. This is nationwide, okay? Individuals who belong to a qualified SPAP are eligible for an SEP to make one enrollment request at any time through the end of each calendar year, once a year, okay? SPAP applicants may use the SEP to enroll in a Part D plan outside of existing enrollment opportunities, allowing them, for example, to join a Part D plan upon becoming an applicant of an SPAP, or to switch to another Part D plan, okay? In summary, a beneficiary may use the SEP to switch from an MAPD plan to another PDP or PDP plan. Or if they're on original Medicare without a PDP, they can enroll, stay on original Medicare and add a PDP or add a MAPD plan. From a PDP to another PDP plan or an MAPD plan, or from an MA only plan to a PDP or MAPD plan. In addition, individuals no longer eligible for SPAP benefits will also have an SEP beginning the month they lose eligibility, plus 2 additional months to make an enrollment choice to another PDP or MAPD. So you help them apply, they get approved. No matter what scenario they're in, even if they're on original Medicare, you can put them on a Medicare Advantage plan, okay? Or you can put them on a PDP plan, okay? Let's say they get approved and then a month later they get denied. Well, they still get an SEP because they got denied. They get that month plus 2 extra months to go on choose another plan. So you can use this to open up an SEP for your members to join any plan that they choose, okay? Guys, if you didn't hear that, go back to YouTube in a couple days, watch this video again, because I just gave you a $10,000 tip. That is huge, okay? So help them apply for extra help. If they get approved, they get an SEP. If they get dropped, they get an SEP, okay? So go out there, learn about this program, benefits checkup, which is in the chat. You can check that out, become a pro at that. We use it internally. If you need help with it, or if you just want us to help you with it, you can shoot it over to Angie and we'll be glad to help you out, okay? All right. Well, we're at the top of our call. We went a little bit over today. I want to thank everybody for being on the call today. Thank you very much for all you do for our community, and let's go out there and save some lives. I very much appreciate all that you do. Please make sure that you go out and leave us a review, because we want to give away a vacation. All right. Thank you all. Have a fantastic and wonderful week. Take care.